Welcome to the Retreat Radio, where we go beyond temporary fixes and surface-level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it. Hello, everybody, and welcome back to the Retreat Radio. I am Heather Witt, and today I am very excited for the topic we're going to be talking about. It has been just surging in the industry right now, and the whole premise of this podcast is to talk about the trends and figure out, is it really worth it being a trend or not? And I'm going to give you guys the real nitty-gritty today. So we are going to be talking all about the different types of regenerative biologics between PRP, PRF, PRFM. We're going to be talking about the gels. So we're going to be talking about PRF gel or EzGel, as it's kind of known in the industry right now. And then also what we're using as biogel, which is PRP gel. So PRF is really big right now. It really is kind of the gold standard if you're deciding between PRP or PRF. However, the moment that you make that into a gel, the dynamics completely change and it stops behaving like a PRF. And so this is why here at the retreat, we have stopped using PRF gel or EzGel and why we have made the switch to PRP. This is going to be a good one. And so whether you're a patient or you're a provider, you're going to want to listen. So let's jump right into it. So let's start with the basics. Let's talk about what exactly the difference really is between PRP, PRF, and PRFM, because we really need to know that before we start diving into the rest. PRP is kind of the most basic, the most classic. This was identified in the 1970s, and then it was introduced to aesthetics in the 2000s, especially more so in the 2010s. This is a liquid. PRP is in its simplest form. What happens here is that the tube that we use to collect the blood contains anticoagulant, and it also contains a gel separator. So when you spin out your product, which is normally at a higher RPM, it basically separates out the red blood cells from your plasma, which contains all of your platelets. And then when you inject this PRP into a patient or into tissue, this is going to release all different kinds of growth factors. And it's going to kind of give you an immediate burst of a treatment. So it's going to release those growth factors. They're going to do their thing and it's going to kind of be washed away and done, usually within about 24 hours. Also, the amount of plasma that the platelets are contained in is a much larger quantity. So you're having to inject a lot more liquid in order to get all of those growth factors. Now, PRF, which is kind of a more advanced form of this, which is really truly what we use nowadays in aesthetics. Practices that are still using liquid PRP, I think, are a little bit behind on the times. That's just my opinion. PRF is different in that the tube that we use is completely sterile and there's no anticoagulant in it, and there is also no gel separator. So what happens is that when we spin this in our centrifuge at a little bit of a slower rate than we would a PRP, you're going to still get a few white blood cells into that plasma as well as some fibrin. And now when we inject this fibrin or we inject the PRF into a patient, this fibrin kind of gets activated within the tissue and it creates the scaffolding network. And what that does is it traps the platelets there, and then it also calls on more additional platelets from your body to release even more growth factors, and you're going to get a little bit more of this sustained release for about 7 to 10 days. PRF was identified in 2001, and then it was introduced into aesthetics closer to the 2010s. Okay, now PRFM is a little bit confusing, and I think that this term gets thrown around and it gets used interchangeably with the gels as well as with PRP, PRF. So what PRFM really is it is still more of a liquid product in terms of what we're trying to treat with it, but we are basically starting with a PRP. So we are drawing the blood and spinning it to extract a PRP product off of it. And then we are artificially creating a PRF type product. So we're usually using calcium or thrombin that we're injecting outside of the body into the tube, into the PRP, to create PRFM, which we then inject back into the patient. So what this does is it creates this start of this scaffolding outside of the body, and that allows for a more controlled, predetermined scaffold that you know is going to be exact each time before you inject it. You don't have to worry about anything going on in the body that could potentially disrupt this process like you could with PRF. The PRFM is going to give you a little bit more structure than you would get with PRP. But again, it's not a volumizer. So this is not interchangeable with any of the gels that we're going to be talking about later. This is still strictly a skin rejuvenating type product. The other benefit to PRFM is that in it having more structure than a PRP, when we inject it, it is going to stay more in the vicinity that we're injecting it. So let's say, for example, we're injecting it into that tear trough area or underneath the eye. When we're using a liquid like PRP or even PRF, sometimes that liquid can just spread all around. If we really want a tight spread on that and we want it to stay exactly where we're putting it, using something like a PRFM can help with that because it's already started that kind of matrix process outside of the body. So it's going to stay put where you need it. And to me, that really is one of the only additional benefits to it over something like a PRF, because the PRF is still going to biologically be a little bit more active in getting you more growth factor release or better results. So I couldn't find an exact date on when this was founded or when it started coming to the aesthetic market, but what I could find was the first peer-reviewed aesthetic study, which was done in 2021. So this is relatively new compared to PRP and PRF. So just to kind of recap and summarize that, all three of these is what we would use for regeneration of the tissue, not for volume replacement. So we have PRP, which is a liquid, which is a fast release that kind of throws out those growth factors and it's done. We have PRF, which once injected into the body creates a fibrin network, which calls on more growth factors and allows for a slower, more sustained release of those growth factors over about 7 to 10 days. And then we have PRFM, which is similar to PRF, except for that it is a kind of synthetic or an engineered scaffolding that is made outside of the body that when injected is a little bit more reliable in terms of the quality of it. However, it is not as strong as a PRF, but where it also benefits is that it was kept a little bit more tight, so it doesn't spread around as much when we're using it like a PRP or a PRF would do. All right, so that's all fine and dandy, but clinically, how do we use these? So that's great to kind of know the definition and the difference between all of them, but how would we actually use these in aesthetics and when would we choose each one? So let's start with PRP. So PRP is, I just don't think it's used very much in aesthetics anymore, except for in gels, which we'll talk about later. But sometimes when you might want to still choose PRP is when you're wanting to have a more even distribution across the treatment field, or when you are trying to have a smooth flow, or you're trying to have a mixture with something with the PRP and you want it to like mix together nicely and be able to flow through your needle very nicely. Examples of this would be for something like microneedling. I think a lot of us think PRF is better, so let's use PRF with our microneedling and use that topically. However, if we want this to be able to seep into those holes we've made with that microneedling pen, we don't want something that's creating this fiber network and creating this kind of clot. We want something smooth and something that's going to spread. So this is actually where PRP would still be a better choice for microneedling. Now, these days, we are using more topical exosomes or growth factor serums that are, I think, a little bit stronger and contain more growth factors than what's in our blood. But if you still want to use a blood product, PRP would be the choice here. And when you are mixing a blood product, PRP, PRF, PRFM, if you're trying to mix that in with anything else, a filler, a gel, Sculptra, you're going to want something like a PRP that is going to be smoother and is going to mix nicer and is not going to create these clots and this unevenness. So those are the kind of only instances where I would still reach for a PRP. If we're talking about PRF, PRF is a great regenerative product for crepey skin, for kind of shrink wrapping or tightening the skin a little bit. I use this anywhere that I would be injecting, let's say under the eye, so in the tear trough area. If you're trying to chase like little fine lines or wrinkles like across the neck, anywhere else on the face, that is typically where I would use something like a PRF. You can use this in O shots, you can use this in P shots, you can use this in hair restoration treatments. But again, for most of these things, at our practice at least, we're not really reaching for blood products anymore because there's not a lot of growth factors in your blood products as there are in some of these other birth tissue biologics that we can be using. But that is for another podcast on another day. But don't you worry, we will be going through that. But that is where you would choose something like a PRF. Now, PRFM is a little bit more of a middle ground. So this is what you might want to choose if you're wanting, like we discussed earlier, control over your placement. So you're putting it somewhere where you want it to stay exactly where you're putting it and you don't want it to spread around a ton. And this is also something where if you want it to be a reliable product, so you want to make sure that the patient is getting the same treatment from treatment to treatment, because by creating that scaffold network outside of the body, you already know for sure that it is formed appropriately. And then when you inject it, it's going to do its thing. That's really the only time that I would choose that. I don't think a lot of practices are really using this. Again, because we're not really injecting a lot of blood tissue products anymore these days because there are just so many better options out there. All right, so let's switch gears now and let's start talking about the gels, which this is really the meat and potatoes of this podcast. This is the whole purpose for this podcast. Biogels are something that's really cool that I think is really going to be a great thing for aesthetics. We've been using it a lot in our practice and we've been having really great results with it. What a biogel is, we are still using something like PRP or PRF, but we are taking a portion of that, the albumin portion of it, and we are heating it, and this creates a gel-like substance. And then we are mixing that together with the liquid PRP or PRF portion of it. And this creates this kind of smooth, injectable product that's really cool because it has volumizing effects from the gel, but then it also has regenerative effects from the liquid PRP or PRF that is in it. And this is where this whole market of PRP, PRF, and these biogels gets confusing because a lot of providers are intertwining the terms. And they're using PRF to get volume in a patient. They're telling them, hey, if I inject this PRF under your eye, you're going to get volume. You will not. You need a gel product if you are going to get any volume. But the nice thing about these biogels compared to something like, let's say, an HA filler, like, Juvederm or Restylane, is that you are also getting the bioregenerative effects of that liquid PRP, PRF that's in there as well. Whereas with an HA filler, you're really not getting that. You're just getting the volumizing effect. The other nice thing is that with something like an HA filler, they pull water over time. So over time of having them in your face, if not done correctly, and sometimes just naturally over time, if you keep layering, is you start to get this kind of waterlogged look. So you get this puffiness to the face if you're doing too much of it. And with something like a biogel, that's not going to happen because it does not pull water over time. So you're not going to get as big of a result as you would get with something like an HA filler, because again, remember an HA filler, some of them have a lot of structure to them. So we can use them to mimic bone and to really build out and shape something. With something like a biogel, we can't really do that. We're just adding nice fluffy volume on top. So we still need to know when and where to use it, but it can be a really great alternative to a filler in certain spots. So let's talk about why I choose to use PRP as my base for my biogels versus the glamorized and the, trending EzGel or PRF gel that's trending in the market right now. And I think that if you break down these products and you understand how PRP, PRF, and PRFM behave and how each of them behaves when they are mixed in with a gel, then it's super simple to kind of come to a conclusion of why you should be using PRP as your base. So there's three really main concepts behind why PRP is better when you are using it in a gel form than with using PRF. So those three concepts are, number one, PRF behaves like PRP once it's mixed in with a gel. The second concept is that PRP is more uniform and smooth than PRF. And the third concept is that white blood cells that are in PRF will degrade gel faster. So let's kind of break down each one of these a little bit further so that we can understand. Back to the first concept, PRF behaves like PRP once it's introduced into a gel. So what this really means is what makes PRF, liquid PRF, so great and so special is that when injected, it creates this fibrin network that we talked about, which allows it to slowly release growth factors over a longer period of time and also calls on more of your own growth factors. So in essence, in lack of better words, it is a stronger treatment than a PRP treatment. However, when you mix PRF into a gel, like when you make that albumin gel, that fibrin network can no longer be created. So when you are trying to build the scaffolding, it needs to be in human tissue and it needs a lot of other factors. It needs the right pH, it needs space to be able to do its thing, it needs calcium, it needs thrombin. And when it's mixed in with a gel, it does not have any of these things. It does not have the right pH. It does not have room to expand because that gel is holding it in. And it doesn't have the calcium or the thrombin to have the reaction take place to build that fibrin network. So basically all this means is that the regenerative potential of the PRF portion of your gel is just that of a PRP. So you're not getting anything extra or anything special by using PRF versus PRP when you are mixing it in with a gel. So basically you're getting the same regenerative power. Concept 2 is that PRP is more uniform than PRF. So if you remember earlier in the podcast, we were talking about times when you would choose PRP over PRF as a liquid form would be when you're wanting something and you're mixing it with other substances because it creates a smoother, more uniform product. And this is because PRP does not have the fibrin in it. It does not create those clots, so it distributes more evenly, it preserves its structure better, it creates a smoother, more predictable product, and when you're using something like a PRF, you can get clumps, it can disrupt the gel, and when you're trying to kind of inject that through your needle into the patient's face, you might not get as smooth of a laydown and you can get more lumps and bumps. So once again, once you're mixing it together with another product, PRP is going to be the better choice to create a more uniform, smooth product, especially when we're working in areas like the under eye. And then finally, that third concept, which is kind of my favorite one that I did a lot of research on because I did not know this. And this is why I used EzGel myself for years and years and years. And when I first heard about PRP gels, I was like, why in the world would these companies make this product and use PRP? Everyone knows PRP is not as superior as PRF. Why would we even reach for this? Why are they even trying to sell me on this? So went to my little laptop, did a bunch of research, read a bunch of articles, went down the rabbit hole. And when you look at the science of this, it's clear to see, oh my gosh, once again, marketing and trends and fads have completely dismantled our industry and have kind of steered us away from looking at science and using the correct product that's going to be the best for what we're trying to do. This is that third concept, is that white blood cells in PRF are going to degrade your gel faster. And all this means is that you're not going to get as long lasting of a volumizing product when you are using PRF as your base. PRF, one of the hallmarks of it is that it contains more white blood cells in its mixture than something like a PRP. And when we are using this as an injectable liquid, this can be really, really beneficial for regeneration of the tissue. However, these white blood cells also create inflammation. They release enzymes. They release matrix degrading enzymes and proteases. And all of these things, when you mix this product into an albumin gel, are going to do just that. It's going to degrade that gel at a much faster rate than if you were using something like a PRP, which does not contain those white blood cells. We now have the situation where we are mixing a product that breaks down proteins more quickly, and we're mixing that into just that, a protein albumin structure that we are trying to put into a patient's face to create volume over time. So we're going to get less duration, we're going to get faster breakdown, less sustained volume, And exactly what we had been seeing with EzGel in our practice is that they still get this great regenerative effect, but when they come back, even sometimes at a 2 or a 4 week follow-up, the volume is like virtually gone. With the PRP gels that we have now been using, when we've been seeing patients at those follow-ups, the volume is holding beautifully, and that's exactly what we're trying to use this product for. So I'm going for longer volume. So that all sounds great and dandy and really nice on paper. However, this is where I always start to get very, very frustrated with aesthetics, because I could not find a single study that directly answered this question or head-to-head compared a PRP gel with a PRF gel in any type of a clinical trial for me to be able to use that as backup evidence to these claims. And that's the frustrating thing, is a lot of these papers that I found, and even papers that different companies are recommending that are telling you their product is better than somebody else's, if you really read between the lines of this study, it sounds promising when you first start to read it, but when you really look into the methods and how the study was designed, the endpoints, they really come up short. Sometimes they're not comparing the right thing and they're saying that PRF gel compared to PRP gel, but really when you look at the methods, they're using a PRP liquid compared to a PRP gel. And of course the gel is going to last longer. It's a gel. Or my favorite thing is when it has vague endpoints. So, oh, the treatment group looked better 3 months later. Better how? More volume? Did they have less crepey skin? Was there more collagen? Did you use a device to measure that? That's great if they had less crepey skin, but that is what a PRP or a PRF liquid is supposed to do. But what I care about is how much volume did they gain and how long did that volume last? And so these are the things that can be frustrating, in that we want to use real world study evidence to back up these claims, but oftentimes we just don't have these studies yet, and there isn't enough money for these companies to do these studies properly themselves. So this is one of the biggest problems. They don't really answer the questions that really matter to us clinically. And so what can we do? What most of us do, and what I have chosen to do, is I look at scientific reasoning, and then I look at clinical evidence. And what I mean by clinical evidence is, what am I actually seeing in my chair? What am I seeing happen on my patients? And so if we look at it from this regard, scientifically, it makes sense that PRF could shorten gel duration, because scientifically how it works and how it behaves when it's introduced to a gel. And clinically, what we're seeing in our practice is matching that. So we were seeing very, very fast degradation of those gels. And now with a PRP-based gel, we are seeing much, much longer duration and much better volumizing effects, which is what our patients are asking for, which is what we are marketing to them. So I quickly want to touch on PRFM again, because again, if we think about this scientifically, we now have decided that we want to make a PRP gel, because now we know that whether we choose PRP or PRF, we're not going to get a lot of regenerative effects. We're going to get the regenerative effects we could get from a PRP. And when we mix it with a gel, we're going to get a longer duration with PRP. So this is what we've chosen. But I want more regenerative effects for my patients. So why don't we use PRFM? That should solve the problem, right? We've already created the fibrin matrix outside of the body, so we don't have to worry about when we mix that in with the gel that it can't do its thing. So why don't we try that? However, again, if we look at this scientifically, that is not going to correctly solve our problem, because even once that fibrin network is created, in order for it to do its thing and to call on those growth factors and to release the growth factors from it, it needs to have contact with surrounding human tissue. And again, once it's in a gel, it cannot do that. And so it's going to behave again just like a PRP. But again, because it has the fibrin in there and because it does have more white blood cells, it will also break down your gel more quickly. So taking all of those things into account, if you are truly looking for something to use a blood product and you're trying to get volume for your patient, number one, you need to use a gel product. And number two, PRP is the best option for longevity for your patient. So this brings me to my next point on kind of what we do clinically, depending on what type of result we're trying to achieve in a patient. So if we just want strict regeneration of the tissue, meaning we want skin tightening, we want to build collagen, we want to thicken the dermis, we are going to reach for a liquid PRF product. if we're using a blood product, because again, this is going to release over the long term and it's going to give you kind of the strongest results. However, at our practice, we have chosen to use advanced biologic growth factors that we can inject in the area. This can be an exosome product or a stem cell product, and these are much, much stronger than your blood. And so we typically reach for those. This will be a whole nother podcast where we can talk about all that, so stay tuned. If we are wanting volume and we're not wanting to reach for an HA filler, this is where I'm going to use a gel product, and this is where I'm going to use a PRP-based gel. If I am wanting to combine them, so I'm wanting to get volume in the area, but I'm also wanting to regenerate the tissue because, as we discussed, a gel product is not going to give you the best regenerative properties, I will alternate my treatments. So I will do a gel treatment to get the volume, and then I will do either a liquid PRF or an advanced biologic treatment in that same area at a later date to basically give more stimulation for that regenerative effect. And this is how you can, as a patient or as a provider, to give to your patient the best results. I know we want to try to cut treatments down and do one treatment. I know you want to try to save them money, but really, if they are wanting the best of both worlds, you need to explain to them the limitations of each treatment before you start moving forward. So this is something in the field of aesthetics that I think is very confused, is very misled to patients. There are huge differences between liquid blood products, gel products, and advanced biologics, and they do very, very different things. So we're going to reach for a gel when we need volume and structure, and we're going to reach for a liquid blood product or an advanced biologic if we need regenerative effect, because unfortunately, there is no one product that combines both to get the best of both worlds. So you need to separate them and you need to do two different treatments. And when you are choosing a gel treatment, it's very important that you're choosing the right blood product to create your gel, because you want this volume to last long term for your patient and you don't want to shortchange them. So I hope that this has been really helpful. This is a very complex topic, and I think it's often misunderstood even by providers, so it can be even more confusing for patients. But I hope that this helps. And if you guys have any additional questions on any of this, please reach out to us. You'll find all of our contact information at our little end slide here. You can reach out to us on Instagram or social media, shoot us an email. We would love to help out whether you're a patient or you are a provider. So I hope to see you guys again soon on the next episode. Have a great rest of your day. Bye-bye. The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.